Hi, on occasion of World Heart Day, that is 29th of September, I wish everybody a very happy and healthy World Heart Day. I am Dr. Swapnil Deshpande, cardiac surgeon from DR.K.G. Deshpande Memorial Center, Nagpur. Actually, this is a very interesting topic which we are discussing today, and there are a lot of myths and a lot of beliefs amongst all of us regarding what is the effect of COVID on heart disease, on heart. We have to thank the Indian government, especially our Prime Minister Narendra Modi ji, to have started this vaccination program and has successfully run this vaccination program in a vast country like India. It is very commendable for the government of India to have reached 200 crores of vaccination. And India is being looked upon by various countries, including USA, England, and Russia, in management of COVID and management of COVID vaccination. COVID vaccination is a must for everybody. And we have seen that patients who have been vaccinated with COVID, they are definitely having less symptoms of COVID, and this definitely having very few complications related to COVID. There have been some few sporadic cases in which patients who have been vaccinated after COVID have had a sudden cardiac death. There is no hiding the fact that there has been few cases, but they have been very far and few. On investigation, it has been found out that some of these patients have had some problems of heart disease, for which they were taking some blood thinners in the form of ecosprin, clopidogrel, or acetron, and during vaccination, the patient had been advised stoppage of these blood thinners, which have led to problems. So it is my sincere request and sincere advice that is to, if you are on any blood thinners, please do not stop these medicines during and after vaccination, because if you are on these medicines, then no problem will happen. It is, even we have taken vaccinations of second dose, third dose, and everybody in our family have also taken second dose and third dose, and nobody had a problem. There have been few cases in which there has been a problem, but the thing is, we have to see for the greater good, and we have to see for the protection of ourselves and our families and our next generations from COVID. And for that, vaccination is primary treatment and primary made of prevention. Okay. So, is there any questions regarding these topics?
Doctor, the question is from my end. So
Yeah.
I'm seeing there's a lot of reports which is getting published, and there are a lot of studies which are saying that the vaccination could have been the one of the reasons, and especially the mRNA one. Okay, so what is your thoughts about it?
See, basically, vaccination has been one of the methods with which we have prevented spread of COVID and have prevented decrease in the symptoms and severity of COVID, which the third wave was not very difficult. The second wave was very grave, but because of the vaccination, the third wave, in which the vaccine virus was even more infective, was spreading even more. Still, we could make out without any hospital admissions or very few hospitalizations. So vaccination have definitely prevented that. But the COVID vaccine has shown to have some individuals, hypersensitivity in some individuals, which have led to formation of these clots and sudden cardiac deaths. So that is the reason why COVID vaccination has come into disrepute. But it is no need to get frightened of it. If the important thing is, if you are on some medications, please do not avoid those. Please continue on those medications and then take your vaccine. Only then these complications will be very less.
Sure, sir. Thank you.
Yeah.
So there's another myth. I don't know, is it correct? A lot of people are saying that if you have had a cocktail vaccine, a lot of people have been, they say there's the heart, heart attack and cardiac arrest were
Yes.
more. Is it true, or
Thing
what's
is,
your?
so because these viruses, the vaccines which we are taking, they are live vaccines, live attenuated vaccines. Live attenuated vaccine means the virus is alive, but its virulence is reduced. Virulence is reduced means the infective part of that virus is reduced. Depending upon the individual patient's immunity and individual patient's hypersensitivity, these viruses, these vaccines react. Some patients, some people have increased fever, increased symptoms. Some patients have absolutely nothing. So it is always better when you have a newer vaccine, like a COVID vaccine. It is always better to take it as a single vaccine rather than take it as a combination of along with H1N1 or influenza vaccines. It is always better to take individual vaccines because the other vaccines which we take as a mixture of vaccine or a multivalent vaccine, they are all tested vaccines, time tested vaccines, and they are dead vaccines. I mean, dead virus vaccines. These are live vaccines. So it is all, and they are newer vaccines. They have been started up in therapy is as a very special case of patient administration. The long-term results are still yet to come. Even we don't know what will be the long-term when we have to take additional vaccines, whether we have to take the fourth dose, whether we take the fifth dose, 6 monthly, 1 yearly. So it is always important to have take this vaccine individually and not as a combination.